Good morning. Coming to you guys today to talk to you about immunity. Just like everything in 111, this is going to be a building block moving forward. This is pretty heavy in anatomy and physiology, so just hang in there, rewind back where you need to, look for extra learning resources where you need to if you're unable to understand. Immunity is what we talk about when we're talking about the body's protection from illness or disease, and it's maintained by the body's physiologic defense systems. So pretty much the function is having the body's defense system recognize and remove foreign antigens. So antigens is what we're going to use as the term as far as those markers that your body cells look at and say, hey, you don't belong here. So we'll look at each piece of the immune system's functioning in just a few minutes. So first, let's just watch a quick video that's going to give us an overview of the immune system.
A mosquito lands on your arm, injects its chemicals into your skin, and begins to feed. You wouldn't even know it was there if not for the red lump that appears, accompanied by a telltale itch. It's a nuisance, but that bump is an important signal that you're protected by your immune system, your body's major safeguard against infection, illness, and disease. This system is a vast network of cells, tissues, and organs that coordinate your body's defenses against any threats to your health. Without it, you'd be exposed to billions of bacteria, viruses, and toxins that could make something as minor as a paper cut or a seasonal cold fatal. The immune system relies on millions of defensive white blood cells, also known as leukocytes, that originate in our bone marrow. These cells migrate into the bloodstream and the lymphatic system, a network of vessels which helps clear bodily toxins and waste. Our bodies are teeming with leukocytes. There are between 4,000 and 11,000 in every microliter of blood. As they move around, leukocytes work like security personnel, constantly screening the blood, tissues, and organs for suspicious signs. This system mainly relies on cues called antigens. These molecular traces on the surface of pathogens and other foreign substances betray the presence of invaders. As soon as the leukocytes detect them, it takes only minutes for the body's protective immune response to kick in. Threats to our bodies are hugely variable, so the immune response has to be equally adaptable. That means relying on many different types of leukocytes to tackle threats in different ways. Despite this diversity, we classify leukocytes in two main cellular groups, which coordinate a two-pronged attack. First, phagocytes trigger the immune response by sending macrophages and dendritic cells into the blood. As these circulate, they destroy any foreign cells they encounter, simply by consuming them. That allows phagocytes to identify the antigen on the invaders they just ingested and transmit this information to the second major cell group orchestrating the defense, the lymphocytes. A group of lymphocyte cells called T cells go in search of infected body cells and swiftly kill them off. Meanwhile, B cells and helper T cells use the information gathered from the unique antigens to start producing special proteins called antibodies. This is the pièce de résistance. Each antigen has a unique matching antibody that can latch onto it like a lock and key and destroy the invading cells. B cells can produce millions of these, which then cycle through the body and attack the invaders until the worst of the threat is neutralized. While all of this is going on, familiar symptoms like high temperatures and swelling are actually processes designed to aid the immune response. A warmer body makes it harder for bacteria and viruses to reproduce and spread because they're temperature sensitive. And when body cells are damaged, they release chemicals that make fluid leak into the surrounding tissues, causing swelling. That also attracts phagocytes, which consume the invaders and the damaged cells. Usually, an immune response will eradicate a threat within a few days. It won't always stop you from getting ill, but that's not its purpose. Its actual job is to stop a threat from escalating to dangerous levels inside your body. And through constant surveillance over time, the immune system provides another benefit. It helps us develop long-term immunity. When B and T cells identify antigens, they can use that information to recognize invaders in the future. So when a threat revisits, the cells can swiftly deploy the right antibodies to tackle it before it affects any more cells. That's how you can develop immunity to certain diseases, like chickenpox. It doesn't always work so well. Some people have autoimmune diseases, which trick the immune system into attacking the body's own perfectly healthy cells. No one knows exactly what causes them, but these disorders sabotage the immune system to varying degrees and underlie problems like arthritis, type 1 diabetes, and multiple sclerosis. For most individuals, however, a healthy immune system will successfully fight off an estimated 300 colds and innumerable other potential infections over the course of a lifetime. Without it, those threats would escalate into something far more dangerous. So the next time you catch a cold or scratch a mosquito bite, think of the immune system. We owe it our lives. Ted.
Okay, so let's talk about different systems in the body that are that impact your immunity. So first up is going to be the lymphatic system. So the lymph channels and capillaries connect to lymph nodes. Those nodes remove foreign material from the lymph system before it can enter the bloodstream. Those nodes are the center for different immune cells to be stored and made. So T cells, B cells, some plasma cells will be found in the lymph system. Next up, bone marrow. Bone marrow is going to be where white blood cells are made, and we'll get more into white blood cells on the next slide. They come from stem cells and differentiate into different types, which we'll talk about again on the next slide. So they are made in the bone marrow. Next up, the thymus gland it's located in the mediastinum of the chest, and it's responsible for making mature T cells, young T cells, and gives T cells some immunity. So all these different types of cells will go through as this progresses. So don't get too caught up on that, on those specific cells if you didn't know what they were. We'll talk more about them. The spleen acts like a filter. So it removes old and injured cells that have been destroyed, the red blood cells that have been destroyed. And then it also holds a concentration of white blood cells, T cells and B cells. And then it also stores platelets. So let's talk about immunity and different types of immunity. So there's two generalized types of immunity. There is natural immunity, or innate immunity is another term for it. And then the other type is acquired or adaptive. With natural immunity, this is going to be what you're born with. It is innate, it is already there. It is also non-specific and gives broad coverage. It protects us without remembering. So it's going to be the first thing that happens, that first line of defense after exposure. The goal of natural or innate immunity is going to be to destroy the antigen, and then it will also start the process of acquired immunity, which we'll talk about in just a second. Things involved in your natural immunity is going to be all of your mucous membranes, so your respiratory tract, your GI tract, the cilia in your respiratory tract, you know, that coughing and sneezing responses to get rid of things, that's part of that natural immunity, trying to keep away pathogens so that there's no infections in the respiratory tract. There's also chemical barriers like mucus and acidic gastric secretions. There's enzymes in your tears and saliva that help to keep antigens from invading. And then your skin also is going to be that big covering of your body, keeping back anything from invading inside. Acquired or adaptive immunity requires prior exposure to an antigen. So that may be through immunization, or that may be because you actually had the disease. So what happens is after you've had it, then your body produces antibodies so that it can recognize it the next time. So weeks or months after exposure to the disease or a vaccine, the body produces an immune response that is sufficient to defend against the disease on re-exposure. So that's going to be what that acquired immunity is. So natural is what your body's already going to do. And then acquired means that you've had some exposure, and so then your body recognizes it the next time and does a better job of taking care of it. So we've got another video to watch to help to understand this. I'm using a lot of videos in this PowerPoint because it is just kind of hard to understand. So the more visual aids, in my opinion, the better.
The immune system's first defense is our skin, the largest organ of our body. The skin covers a total area of about 2 square meters, the size of a typical basketball backboard. When microbes attack, they're routinely deflected by the skin. Inside our bodies, mucous membranes are slimy, warm surfaces that make up about 400 square meters, roughly the size of an entire basketball court. They're under constant attack from microbes in the air we breathe and the food we eat. They line our nose, throat, intestines, and reproductive tracts. That's a large area to defend. Your mucous membranes are going to need help. Fortunately, certain cells in your body have evolved to fend off microscopic attackers. Early responders, like this macrophage, identify invaders and attack. They also give off chemical signals, called cytokines, to call up reinforcements like neutrophils and natural killer cells. Macrophages, neutrophils, and natural killer cells, collectively referred to as innate immunity, are nonspecific, often sacrificing healthy tissue to contain an infection. But if the invader slips through, you're going to need a more targeted defense. The adaptive immune system provides a more targeted defense. Dendritic cells are like intelligence specialists. They collect pieces of the invader at the site of the battle. Then they travel to the nearest lymph node, triggering a cascade of events. Inside the lymph node, the dendritic cell presents pieces of the invader to T cells, the immune system's communication specialist. In turn, T cells activate B cells, training them to form antibodies, the molecular weapons that target the invader specifically. The immune system now mounts its ultimate defense. B cells release millions of antibodies, each antibody's shape tailored to identify and neutralize the enemy. The immune system deploys these tailored weapons until the infection is wiped out, ready to respond even faster the next time.
So that video used the terminology of innate, which is the same thing as natural, and adaptive, which is the same thing as acquired. All right, so let's talk about your different types of white blood cells. So we have your acronym here. Never let monkeys eat bananas, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So let's talk about each of those. Your white blood cells are also another term for just white blood cells as an overall term is going to be leukocytes. They are your frontline defenders against microorganisms, but they only make up about 1% of your intravascular blood volume. So of your total blood volume, it's only about 1%. So first up, let's talk about neutrophils. These are the first on the scene and make up the largest portion of your white blood cells. About 55 to 70% of your white blood cells are going to be these neutrophils. And they work to engulf and destroy bacteria. Young neutrophils are called bands. So you may see an increased number of bands on your, we're going to talk towards the end of the PowerPoint slide about looking at your CBC. But when you look at a CBC with differential, so that differential breaks out these different types of cells. So if you have a lot of bands or young neutrophils on there, that means that there's an acute infection. So your body's been notified, hey, something's going on. We need some extra neutrophils out here to engulf and destroy the bacteria. So when you see an increased number of bands, that's what is happening. One of the terms that you'll hear is just a shift to the left, and that just means it's shifting to that immature, that there's more immature neutrophils. And then also terminology, you may hear segs. So those are segments. So that's going to be a mature neutrophil. Next up, we've got lymphocytes. These are going to include B cells, T cells, natural killer cells, and these make up about the second largest percentage of your white blood cells, about 30 to 40%. So B cells are going to be the ones that create antibodies. And we're going to talk a lot more about antibodies coming up. But antibodies are used to destroy antigens that you've previously been exposed to. So we'll talk more about those. But B cells are going to be who makes those. T cells are responsible for recognizing non-self antigens, so antigens that don't belong to you, and then attacking them. So they have some stranger danger going on, right? They see something, they're like, hey, whoa, 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 we don't know you. And so then they attack. So you've got different types of T cells. So you've got a helper T cell, which is in this little drawing over here is going to be this guy here. He's the helper T cell. He is going to bring in the help. He's going to attract other type cells that we need to come help. The next type is going to be a killer T cell. And so I feel like obviously this ninja here is our killer T cell. He's coming to directly attack the pathogen. Your suppressor T cells are going to regulate the immune response and keep it in check. So that is this guy here, this suppressor T cell or regulatory T cell. So his job is to keep our immune system in check so that we're not overreacting to things. And then we also have memory T cells that will remember and recognize previous antigens. So then when they see them, so if you've already had a flu and then you come back in contact with that same flu, then it's going to be able to say, hey, I've seen you here before and you're not welcome here. So that's what and so it will start that immune response. Our natural killer cells are exactly what they sound like they are. They attack and destroy abnormal cells. So that is not only going to be bacteria and things, that's going to include cancer cells, right? Because they're just they're abnormal cells, and viruses are also going to succumb to those natural killer cells. Next up, we have monocytes. Monocytes engulf and destroy excuse me, sorry, I was making sure I was recording. I'm always scared I'm not recording. Monocytes engulf and destroy large number of pathogens and toxins. When they move into the tissue, they become a macrophage. And the macrophage function helps to stimulate immediate inflammatory responses, and also stimulates longer lasting immune responses. And we'll talk more about that inflammatory response when we talk about inflammation, but you're going to see that your body's immune system and inflammation are very closely tied. In fact, inflammation is something that your immune system uses in response. So we'll talk more about that in the next bit about inflammation. Let's see. The eosinophils function is most active against infestations of parasitic larvae and also limits inflammatory reactions. So whenever you'll see a lot of these during allergic responses, because they kind of keep things under control. When there's an allergic response, they're going to kind of work sort of like that regulatory T cell does and try to keep things under control. So you'll see a lot of them during allergic responses. And then lastly, the basophils, they move into tissues and they can release histamine and heparin. And then, so these can help cause signs and symptoms of inflammation. So basophils stimulate both general inflammation and inflammation during allergic reactions. So we've got another video to watch to look at and have another visual aid for how these different types of white blood cells work.
White blood cells are immune system cells, and they protect your body from foreign invaders and disease. They make up 1% of blood, with higher concentrations during immune response. There are 5 main types of white blood cells. Neutrophils are the most common white blood cells, and they're often first responders. They can engulf dead or dying cells, and they can ingest microbes. Microbes are microorganisms that in some cases can cause disease. Basophils are the least common of white blood cells, and they release a substance called histamine, which signals other white blood cells to their location and also triggers the capillaries to open up and allow these extra white blood cells into the tissue to join the fight. Basophils also play a key role in allergic reactions. Eosinophils can release toxins which kill pathogens such as parasites and worms that are too large to be engulfed by any one white blood cell. Eosinophils also play a key role in allergic reactions. Lymphocytes are the rock stars of white blood cells. There are 2 types, B cells and T cells. B cells can release antibodies, which bind to microbes and neutralize them. Helper T cells can release cytokines, which are chemical instructions that direct immune response. And killer T cells can release toxic substances that can kill infected cells. Monocytes are the largest white blood cell, and they basically consume dead cells. They can also change into dendritic cells and present antigens to T and B cells, which in turn can attack the antigens and now have a stored memory of the antigen. You can think of antigens as substances that are harmful to the body. White blood cells are essentially our internal warriors, protecting us from invaders. And that...
Okay, so let's talk about cell-mediated versus antibody-mediated immunity. Another term for the antibody-mediated immunity is humoral. So you may hear that term as well. So let's talk first about cell-mediated. So cell-mediated immunity is going to be basically these cells that we just talked about going in and killing the foreign substance or taking out the antigens. And then antibody-mediated or humoral is going to use antibodies to neutralize or eliminate foreign proteins. So antibodies are large proteins, also known as immunoglobulins, that will clump together and take out something that they've already been exposed to. So we'll talk more about immunoglobulins and antibodies here in a couple slides. So I'm going to just let you guys see this video, but basically what I want you to understand is that cell-mediated has to do with those T cells attacking, and then humoral has to do with antibodies or antibody-mediated, is your body's response with when there's been antibodies after exposure. So let's watch a video real quick that'll kind of help explain that.
When you get the latest flu, which these purple dots represent, the antigenic proteins on the surface of the virus cells are recognized by your white blood cells. B lymphocytes, also known as B cells, that produce antibodies that bind to the surface of the antigens, alerting a macrophage to come ingest them, which a macrophage then does. B cells also produce memory B cells that hold on to a fragment of the virus, so the body will know what to do next time it encounters the same flu. This is the humoral immune response. In the cell-mediated immune response, a macrophage will ingest the flu virus and present it on the surface of its cell, becoming an antigen-presenting cell. A T lymphocyte, also known as, well, specifically a T helper cell that also recognizes the flu virus, will interact with the antigen-presenting macrophage. The macrophage will produce the chemical interleukin-1, which spurs the T helper cell to secrete the chemical interleukin-2. Cytotoxic T cells that recognize the flu virus respond to the release of interleukin-2 by finding infected cells and killing them. B cells that recognize the flu virus respond to the release of interleukin-2 by producing antibodies that bind to the surface of the virus cells, alerting a macrophage to come ingest them, which a macrophage then does. Meanwhile, memory B and memory T cells hold on to fragments of the virus cells, so the body will know what to do next time it encounters the same flu. And that's how your body and your immune system deal with the flu.
So I know this content is, like I said, it's very anatomy and physiology, and it's just kind of hard to follow. So don't get overwhelmed. Just what I want you to remember is that your body does two different things. It has a cell-mediated response where it goes in and just kills whatever's there that doesn't belong, and then it also has an antibody-mediated response or humoral response, where it then creates antibodies and basically remembers things so that it can go ahead and attack early the next time it sees these things. So here we've got the T cell. It mounts an immune response against non-self antigens. And then we got the Mr. T cell, who pities the fool, who's not a self antigen. Okay, sorry. Sometimes you gotta lighten the mood. I bet after that last slide, y'all were like, what? Okay, so let's talk about antibodies. So like I said, antibodies are large proteins also called immunoglobulins. They defend against foreign invaders. They are categorized as either active or passive as far as immunity and how you attain your antibodies. So active immunity is developed by your body, and it lasts anywhere from just a few years to a lifetime, but it is what your body has done. So you can have a naturally acquired active immunity because, excuse me, you got a disease or an infection. So that would be a naturally acquired active immunity response. I feel like I need my pencil. Okay. You got it naturally, and your body created an active immunity to it. So then you can also get a vaccination, right? So that is artificial active immunity. Passive is generally temporary, and it is coming from a source outside of the body. So that can be, so that's, your body didn't form those antibodies, something else gave you those antibodies. And so that can be also natural or passive. So natural is going to be mother to child. So that's going to include breastfeeding. It's also going to include in utero, from mom to baby, while baby is still in the uterus. And then you can also have artificially acquired immunity. So passive immunity, remember, the passive immunity is from a source outside the body. So one thing that we see done is that blood can be taken from someone who is already immune to something and then spun down to get the part with the antibodies, the serum. And then the serum is given to a person so that they can have that immunity. And I think that's one of the things that they've been trying with the coronavirus is spinning down and getting the antibody serum from people who've already had coronavirus, and then trying to give it to treat coronavirus in other people, to go ahead and give them the antibodies they need to fight it off. So and I'll talk about some other examples with that in just a minute. So just in a little cartoon of this little antigen, non-self antigen, who got a hat, and his friends are all super upset because he's been marked with an antibody. So now the body will destroy him and not let him back in again. All right, so let's talk about immunoglobulins. Remember, we talked about that there, it's the same as like antibody, it's the same thing. So there are 5 different types of antibodies. They each have a different structure and a different function. So first up, we have IgG. IgG is the most common in the serum and in the interstitial fluids. We see it go up. We see an increase with that when there is a bloodborne pathogen or tissue infection. It has some antiviral and antibacterial properties. This is what you will see when there are subsequent exposures. So just like with the flu, if you've already been exposed to that flu strain before, this IgG is gonna be what pops up with subsequent exposures to that. IgA is found in bodily fluids, blood, saliva, tears, breast milk, etc. And it protects mucous membranes against infections. So including the pulmonary tract, GI tract, GU, it's going to be in those mucous membranes protecting from infection. IgM is responsible for primary immunity. It is intravascular, and it's the first immunoglobulin to made in response to a bacteria or a viral infection. So where IgG is more with subsequent infections, IgM is going to be with that when you first have that that first exposure to something. IgD, there's not very much. It's a small amount, and it's not super well understood, but it does help with regulating the making of antibodies. And then lastly, IgE, we see an increase within allergic and anaphylactic reactions. It also combats parasitic infections. All right, so here we've got the immune response. We've got, first up, we've got these little soldiers down here saying, hey, who's this foreign guy? We need to get ready for the trouble. So the foreign antigen invades, causing an antigenic response. Where's my pencil? Okay. So then the antibody army comes in, gets them surrounded, they attack, and then the body's going to remember this guy, this foreign antigen, in case of any future attacks. So let's talk about factors that may affect the immune system. First up, gender. What we know is that women are at greater risk for autoimmune disorders. And remember, an autoimmune disorder is going to be where your body is recognizing when it's going through that self, non-self. Do you belong here? Do you not belong here? It doesn't recognize some portion of its own cells as itself. And so it attacks them as non-self. So that there is a higher incidence of autoimmune diseases in women than there is men. So that may be something that affects it. Physical and emotional health. If you are physically ill with an infection, and cancer, some chronic illnesses, that will impact your body's ability to fight back. And emotional health is also going to be important. The pathway from the brain to the immune system and the neurotransmitters and endocrine system involvement are going to be impacted by your emotional health. Medications such as antibiotics, corticosteroids, aspirin, NSAIDs, cytotoxic medications will all affect immunity. A diet that is iron, vitamin D, and protein will all affect your body's all those cells that are used to fight things off. Trauma or surgery and that stress of the illness, and it's going to be a whole pathway of how these things will trickle down when there's injury to your body and the way that your blood cells are responding. If you have had immunizations or not will obviously impact your ability to fight off those certain diseases. And then some of lifestyle choices like smoking, alcohol, sexually transmitted illnesses, different exposures to things in occupation or at home, toxins and things can impact your body's ability to fight off illnesses and have healthy immunity. And then a big thing is going to be age-related changes. So immunity is most efficient in adults who are in their 20s and 30s, and then it'll start slowly declining with increased age. So across the lifespan, looking at both ends of the spectrum there, newborns have antibodies passed from their mom through the placenta and then through breastfeeding. And then with the geriatric or older population, we have decreased function in B and T cells. And so they have a harder time recognizing self versus non-self. They have less antibody production. So the next slide's going to has a chart. So let's go ahead and go to that. That's going to talk about all the things that are going to affect the age-related changes that will affect immunity. So you guys have this slide on your PowerPoint, so I'm not going to read it to you because I think that you are all perfectly capable of going over it and looking at these things. So you have changes to your immune system, changes to your GI tract, and how that's going to affect your immune system. And then on down the slide, you've got, like for instance, decreased gastric secretions and motility, and how that's going to affect your immune system. So do take your time and review this chart. Okay, so let's talk about the physical assessment that is specific to immunity, a focused immunity assessment. So we're going to assess for signs and symptoms of inflammation and infection. So inflammation is going to be a separate topic. So we'll you'll have that in a separate video. And then I have inflammation, and Ms. Curley will be teaching you about infection. And the three of these, immunity, inflammation, and infection, are very closely tied. So we're going to assess the lymph nodes. We're going to do anterior and posterior cervical, supraclavicular. Hold on, let me get my pen. Okay, so we've got anterior and posterior cervical. We've got supraclavicular, so above the clavicle, right? That's going to be these right here. Just seeing supraclavicular. We've got axillary and inguinal. So axillary being in the axillary region, and then inguinal down here in the groin area. So when we palpate these lymph nodes, we're going to note the location. We're looking to see, are they enlarged? What is the size? You would need to describe the size, the consistency. So like, is it spongy? Is it hard? Is it moving back and forth? And then is it tender to the patient? And I'm going to go ahead and finish up this slide, and then we'll talk about this lymph node assessment. I'll show you guys a video. So the lymph node system drains distal to proximal. So the hands and arms will drain to the axillary region, right? Going to drain proximal to the axillary region. I'm going to change color. Okay. Drain to the axillary region. Distal to proximal. So legs and feet are going to drain to the inguinal nodes here, right? Distal to proximal. And then your head and neck is going to drain down into these cervical and supraclavicular nodes. So if you had an infection, if you had some enlarged lymph nodes here in this axillary area, then you may want to look distally for the cause, because that's the direction they're draining. And then you'll also inspect for an enlarged spleen. So I am going to show you guys this video of a lymph node assessment being performed.
Palpate the neck. All the lymph nodes, I'm going to start with the pre-auricular, which means before the ear, palpating. When I'm palpating for the lymph nodes, I'm using the pads of 3 fingers, 2 to 3 fingers, and then just using kind of a circular motion, pre-auricular, and then post or behind, post-auricular, and then moving down to the tonsillar and submandibular, submental, right below her chin, and then anterior cervical. Posterior cervical is behind the sternocleidomastoid muscle. Deep cervical you can't feel until, unless you have Miley. Go ahead and turn your head one way. And the way she turns her head, you'll want to kind of press into the sternocleidomastoid muscle, and you can sometimes feel a deep cervical there. Go ahead and turn the other way. But a lot of times the deep cervical are deep, so you won't be able to feel them. The supraclavicular, supra means above, so above the clavicle, supraclavicular, and infraclavicular, or below the clavicle. Finally, the occipital, behind the neck. Okay. And you're feeling for any lymph nodes, which are going to be pea size or larger. If they are normal lymph nodes, they'll be mobile, they'll be non-tender. Sometimes they can be tender, fixed, and hard. Those ones are more worrisome and require further workup.
Okay, so here we have images of an enlarged spleen. You see here, and you're looking for that splenomegaly. And then here's an image of an enlarged lymph node, which is pretty big if you can see it. All right, so let's look at our lab analysis and what we're going to look at. So your CBC is going to tell you your total number of lymphocytes. So when it says WBC, that is your total number of lymphocytes. So all of those white blood cells, the eosinophils and neutrophils and basophils, it's going to be everything. So normal white blood cell count or leukocyte count is going to be about 4 to 10. And then if it is less than 4, it's going to be a leukopenia, and greater than 10 is going to be a leukocytosis. So when you do a differential, it's going to look at each different type of lymphocyte. So what it gives you is a percentage, and that percentage will add up to 100%. So just like we talked about that some of them accounted what the numbers that it accounted for. Actually, let me just go back to that slide and we can look at it real quick just to, so that it's making sense while I'm talking. I just skipped it. Okay, so remember the neutrophils typically make up about 55 to 70%. The lymphocytes then make up about 30 to 40%. And then the monocytes and eosinophils and basophils will make up the rest. So when you're looking at that CBC differential, that's what that percentage is. It should add up to 100 of how much there is of each. The absolute count is going to tell you the actual number of each. And like we said earlier, if you hear that shift to the left, it means there's an increased number of bands or immature neutrophils, and that would be the sign of an acute bacterial infection. And then also remember that an increased number of eosinophils is going to indicate an allergic reaction. And then you can also look at test levels of specific immunoglobulins. For example, an increased number of that IgE would also indicate an allergic reaction and anaphylaxis. All right, so last up, let's talk about vaccinations. So live or attenuated vaccinations will give you about 90 to 95% protection for at least 20 plus years with a single dose. They can usually be inactivated by heat. So some examples of this would be like the measles, mumps, rubella, or the MMR vaccination. And then that influenza nasal spray that they really don't use very much anymore. Inactivated vaccinations offer a weaker response than a live vaccination. So these are the ones that are going to require boosters. So these are the ones that you get that you would have to continue to get boosters for. So it is a killed vaccination, so it does not promote replication and typically only provides about 40 to 70% protection. So some examples of these is going to be pertussis, hepatitis, A and B vaccines, that influenza, the shot that we get for influenza, HPV, and this is what polio was, the type that polio was. Toxoid vaccinations are used when a bacterial toxin is the main cause of the illness. So it is heat treated to weaken its effect, and then that's what you receive, and that's what you get with tetanus and diphtheria. Route of administration is most of the time it's going to be IM. It can also be sub-Q, but you need to make sure that you are looking at the amount, at the correct route, the age of the person, using the correct needle size and technique. Contraindications to getting vaccinations would be if you had a previous anaphylactic or systemic allergic reaction to a vaccine component. If you've had a fever within the last 24 hours, we're usually not going to give it. Sometimes with renal impairment, you'll see that it won't be given. And then some things may be not indicated for women who are pregnant or nursing. So here we have, here a website for specific contraindications for specific vaccinations. And then this other link here is going to be for reporting adverse effects for vaccinations. Side effect for vaccinations typically are mild to moderate. So mild side effects would include local redness or firmness at the site in duration. At the site, soreness at that injection site. Anybody who has had an IM injection knows that soreness typically happens. With children, they may be fussy. You may see tiredness, poor appetite, vomiting, and even a fever up to 103 degrees may still be considered a mild side effect. A moderate side effects are going to be if you see a high fever over 103, seizures, or with children, non-stop crying, not fussiness or tiredness or complaining, but non-stop crying. And then severe reactions, which are very rare, are going to include serious allergic reactions like anaphylaxis, long-term seizures, coma, and could include brain damage. But as I said, these reactions, that severe category reaction, is very, very, very rare. Nursing implications when you are giving vaccinations are going to include providing parents and adults, if that's who you are administering vaccinations to, with appropriate vaccine information, including the benefits and problems. Making sure the immunizations are given accurately. If you're giving an IM medication, that you're giving it deep enough to go into the muscle. We want to make sure we're teaching our clients possible side effects and when to call the physician, which would be with those moderate to severe side effects. Sometimes they may use a topical anesthetic at the injection site to reduce discomfort, especially for children, but that would need to be applied 40 to 60 minutes ahead of time. So it's not always practical. And then making sure you're screening for contraindications or prior reactions to vaccinations before administering. Some pediatricians may recommend that your parent or caregiver gives a child some child age and weight appropriate dose of acetaminophen prior to, but that's going to be a healthcare provider preference. So because we can't prescribe medications or tell them to take medications, but it may be something that the healthcare provider will have you to discuss with clients. And then lastly, here we have the CDC's flu vaccination education. So as we said, one of your nursing implications is going to be education, of course. So CDC has information on many types of vaccination, and this is just the example of one. So that's going to wrap up our presentation on immunity. So a lot of information there. Let me know if you have questions, put a question in the forum, or shoot me an email if you need me to re-explain anything. And I hope you guys are having a wonderful day.